Without further ado, I want to introduce our speaker, Dr. Ruwayda Petrus. She is an expert in the field, a senior lecturer in the Department of Psychology at the University of KwaZulu-Natal, and has a lot of fantastic insight and information to share with us today. So Dr. Petrus, I'll let you take over.
Thank you so much, Rory, for that wonderful introduction. So I'm just going to share my screen to get us started.
As you share your screen, I just want to let people know that we will have a couple of polls coming up now. So if you look to the bottom of your right-hand side of your panel, as well as Dr. Petrus is setting up, and you can do this as I'm speaking, Dr. Petrus, share your screen. But we have a couple of poll questions that are coming through. There will be 4, so just look out for them. And as Dr. Petrus is giving her introduction, please answer these polls, and then we'll be having a discussion about them in just a few minutes. So the first one should be available for you all to fill out now. Great.
Okay, great stuff. Let me just close the poll. Thanks, Rory. Okay, so welcome everyone. And firstly, thank you to the African Federation for Emergency Medicine for giving me this opportunity to talk to you about something I'm quite passionate about, which is psychological health and safety in the workplace. So just to give you a little bit of a broad overview, I'll be touching on what do I mean when I say psychological health or psychological safety. Then I'll talk a little bit about what does it mean to feel safe at work. Why is it important for us to feel safe at work? And how can we help employees feel safe at work? And then lastly, I do have a couple of slides around resources and tips that you can take away from this webinar. So COVID-19 has forced us all to rethink the way we work, the way we teach, the way we provide care. And in a recent review conducted, it was found that healthcare workers experience a range of effects as a result, psychological effects as a result of COVID-19. Many of them physical, but it also highlighted quite a bit of psychological effects that they were going through, most notably high levels of depression, anxiety, insomnia, and distress. And what was particularly interesting is that female healthcare workers and nurses were disproportionately affected. Now, as much as, you know, this webinar is geared towards the healthcare setting, I do think that what I'll be sharing today is applicable for even those of us that are not within the healthcare setting, that are maybe in academia, in corporate, or just a general member of the you know, of society. That's perfectly, all of this would be applicable for you as well. So we all know that it's human nature to want to present ourselves in the best light possible. And whether you're in healthcare or in academia or whatever profession you're in, asking for help can sometimes be seen as a weakness. In a recent survey, in a survey that we did as part of the PRIME study, we found that healthcare workers were very quick to state that they would not discriminate against a colleague who had a mental health condition. However, what was really interesting for me is that many of them said that they would not disclose if they themselves were having challenges. And this is what sparked my interest in this whole concept of psychological health and well-being in the workplace, and how we can start to create spaces of safety where staff don't feel as if they'll be negatively viewed or seen in a negative light if they were to share that they were struggling. So as Rory mentioned, there is a poll that you would have popped up on your screen, and the questions are really just focused on trying to determine how comfortable you would be disclosing to either your manager or to a colleague if you had a mental health condition or if you were having a hard time at work. And the purpose of that is just, I think it's quite interesting and really important for us to start that dialogue about what do we think and what are some of the things that we hold in regards to mental health and well-being in the workplace. So from the poll, I can see that majority of you say that yes, you would be comfortable. And I can see that we still haven't completed the poll, but just going off of the first result, where many of you shared you would feel comfortable disclosing, that's quite encouraging. However, we need to be aware that not everyone feels this comfortable to disclose. Not everyone would go up to their manager and say, I'm not coping. And so that is why it's so important, whether you're a manager or a fellow colleague, it's so important for us to create a workspace that encourages people to be honest, authentic, and not afraid to ask for help. By creating psychologically safe workspaces, we are fostering an environment that is enabling of employees to take control of their mental health. And so what do we mean with psychological safety? The term psychological safety can be fairly loaded, especially because the word psychological is in front of it. It's not a new concept. Psychological safety describes the perceptions of the consequences of taking interpersonal risks in a particular context, such as the workplace. And it's been identified as a critical factor in understanding phenomena such as voice, teamwork, team learning, and organizational learning. It all boils down to the way we treat each other and how we interact while we are at work. And so within the body of research that we have, psychological safety did stem from organizational research, and particularly around what it takes to produce change. The construct of psychological safety has its roots in early discussions, and two professors, Edgar Schein and Warren Bennis, argued that it was essential for making people feel secure and capable of changing their behavior in response to shifting organizational challenges. Now, I think we would all agree that we are currently finding ourselves in a situation, both personally and professionally, that requires us to respond to change, changes in how we behave, changes in how we act, changes in how we learn, in how we practice our profession. And so in order for us to be able to adapt, we need to have the space within our professional settings that can encourage personal and foster personal engagement at work. So what then does psychological safety mean for you as a healthcare worker, or even for you in your current context? We know that in healthcare, collaboration is key. And this is because we recognize that treating patients holistically, which is the key function of a healthcare system and healthcare professionals, requires us to consult others to ensure that the care we provide is personalized, coordinated, enabling, and promotes dignity, compassion, and respect. So Edmondson, who coined or actually has done a lot of research within psychological health and safety, has identified that it's an important factor that helps us to understand how people collaborate to achieve a shared outcome. The outcome in healthcare is that we all want our patients to leave the hospital or leave the emergency room stable and healthy. However, COVID-19 has sort of changed that outcome in the sense that it's become quite unpredictable. You already were working in a very unpredictable environment, and COVID has just exacerbated that. So Edmondson says that psychological safety is particularly important within environments like emergency care, which are known to be high stakes. And healthcare professionals must work both interdependently and independently within a highly complex and dynamic work environment to provide safe care for patients. Now, a lot of the training that you would have had received as part of your undergrad or postgraduate was focused on giving you the skills you need to provide care to patients. Not a lot of it is focused on how to take care of yourself. And that's where psychologically safe workspaces really comes into play. Psychological safety in healthcare is something that helps us to speak up. Speaking up is not only vital to patient care, but it's vital to your emotional health and well-being. When we feel unable to voice our concerns or ask a question, it can hamper our growth and our learning. Also, being in a workspace that doesn't promote questions can increase the risk associated with the type of work we do, because you are left to stress about whether you've made the right call or not. Workplaces that aren't psychologically safe, we find that these certain features like humiliation, blame, criticism, and bullying are features of such workplaces where employees are filled with fear. This was especially something I noticed when I was working in primary healthcare clinics in the Northwest, and I was interviewing nurses, is that for a lot of them, they were afraid to speak up and to say how they could do something better and how the guidelines that they had weren't implementable. And this was all because they were afraid to lose their job. They were afraid to get a bad performance review. And this is what we are hoping to fight by promoting the idea of creating psychologically safe workspaces. Because when a workspace is not safe, you will not get the best out of your people. So early research conducted in China when COVID-19 happened found that a large proportion of health workers had depressive symptoms. They were suffering from anxiety, insomnia, and discomfort. And for me, I sort of tried to make sense of why was this a phenomenon that was happening. And yes, we know that from organizational literature around burnout, that healthcare workers are already stressed, they're already burnt out. But what is driving these numbers to go up exponentially, in my opinion, is fear. And I'm happy for others to share what they think is driving these negative psychological effects within health workers. And when I say fear, I mean fear of getting COVID-19, fear of passing it on to our families, fear of attacks from the public. In a previous webinar done by Prof. Petra, she highlighted some of the experiences that healthcare workers were facing purely because they were a healthcare professional. Ranging from insults to not being served at a grocery store, being chased out of grocery stores or shopping malls because people thought that you were bringing the virus from your place of work, to more severe attacks. And you may be thinking right now, well, I'm not afraid, okay? And that happened in another context to other people. It's not going to happen to me. I have my training. I know how to protect myself. I've dealt with worse. I've seen worse. And you may also be thinking that the anxiety and stress that these healthcare workers are facing, or the anxiety or stress that I'm facing, is as a result of a lack of resources and a lack of healthcare workers. And if we fix that, I'll be okay. Yes, these are measures and strategies that can help to alleviate the physical burden of dealing with the pandemic. But what about the emotional burden? We all know that fear isn't logical. It doesn't ask permission to invade our subconscious. And when left unchecked, it can result in a range of negative psychological and physical effects. So on this note, I want to talk to you a little bit about emotions. Even the leading expert on emotions will be the first to admit that we've only begun to scratch the surface of what we know and understand around emotions. And emotions are also something that are often misunderstood among leaders and managers, no matter the context or the professional setting you're working in. It makes it thus challenging for managers to manage and lead effectively. Pino Gallagher wrote an article in 2014 which really resonated with me. And in this article, the title is Leading Through Emotion, Riding Your Personal Tsunami, in which she writes the following regarding her understanding of emotions. She speaks about how emotion is wild in nature. It's like a wave that we need to surf rather than suppress or block. And she highlights that it's more important to know how to come out of an emotion than how to go into it. And that all we need are three tools: attention, focus, breath, and movement. She's also quite quick to caution us against using this notion that we can tame and control our emotions and put them in a box by building on a phrase we all know very well, our emotional intelligence. Now, you can agree with her or not, but the one thing I'd like to share with you is that we are complex, messy, disorganized, beautifully flawed, strong, vulnerable beings. So why do we assume that our emotions will be any different? If we think about it, the very nature of human beings is that we are a bundle of contradictions. We are strong yet weak. We are thoughtful yet selfish, loving yet stubborn, gentle yet aggressive, and the list goes on. And I think we would all agree that based on the context or the situation we find us in, different aspects of our personality and how we act will come to the front. So emotional intelligence is described as the ability to manage one's own emotions, as well as the ability to recognize and appropriately respond to the emotional distress of others. This is something we teach our students when we do the module organizational behavior. We stress the fact that you need leaders that have high levels of emotional intelligence, who can manage their own emotions and recognize and manage and appropriately respond to the emotional distress of others. Making it sound and trying to ascribe anything else to the concept of emotional intelligence as a tool to control your emotions is foolish, and that's my personal opinion. Because all we can really do is manage what we feel and build our inner capacity to deal with whatever we're feeling and process it. Suntosh Pillay, who's a clinical psychologist, wrote an opinion piece a while back around how people are responding and what people are feeling in light of COVID-19. And he spoke about how we are all busy experiencing an emotional tsunami. And that's because of the uncertainty that COVID-19 brings. One thing I want to stress is that even though we're psychologists or healthcare workers, doctors, nurses, teachers, mothers, fathers, you are not exempt from feelings just because of your profession. Your profession doesn't protect you, but rather it enables you to understand what is happening better than the average person. So therefore, it's highly plausible that just like everyone else out there, you will not be spared from the COVID-19 tsunami of emotions. All we can do is start to be more aware of recognizing what we're thinking and feeling and how it's affecting our behavior. And this brings me to a video that myself and some colleagues of mine created right in the beginning of lockdown. And it happened in response to what we were feeling, a lot of the uncertainty we had around COVID-19, around whether we'd be going back to work, how it would happen, how we would transition to online learning, etc. And as we were talking and reflecting, we realized that if we as professionals in our different areas were struggling with lockdown and struggling with these feelings of uncertainty, how much more so the average person out there who's being bombarded with COVID-19 negative information and just hearing about how it kills and how there's no treatment, there's no vaccine. So we then started to develop a very short video, which is 3 minutes long, around dealing with fear and anxiety related to COVID-19. And the whole video centered around how our thoughts affect our feelings and in turn affect the way we act. And even today, I'm still reminded about how relevant these 3 little words, thoughts, feelings, behavior, have on every aspect of how we either do our jobs and how we engage with our colleagues and with our family and with the greater community out there. It's a way for us to understand not only how we are feeling, but how others are feeling. So at this point, you may be thinking, why should I care, or why should my organization care about psychological health and safety? And that everything I've been saying sounds like another mental health program. And you might be wondering, does this mean that as the manager or as the organization, I'm solely responsible for the psychological health of all the employees? And another common concern we get when we speak to managers or nurses around psychological health or mental health and well-being, it's like, won't this open up a can of worms that I can't contain? And lastly, this is going to add so much more stress to my job as a manager. Legally, as an employer, you have an obligation to your employees to create an environment that is safe and prevents them from being harmed in any way. You as an employee equally have a right to request and demand that you be given the necessary protection to not come to harm in your place of work. This is sometimes easier to do physically and protecting people from losing a limb or, getting hurt on the job. But it becomes a bit tricky when this extends to protecting the psychological health and well-being of your employees. But one thing I can assure you, that by investing or thinking about ways in which we can start to create safe spaces for employees to acknowledge and share issues and challenges they have, this can save an organization time and money. It can reduce turnover. But more importantly, for you as the individual, it can help you to decrease the levels of stress and burnout that you are currently experiencing as a result of not having a psychologically safe workspace. So another important aspect about feeling safe at work, or some of the important things around it, is it's not just a physical feeling, as I said, it's around emotional safety as well. When we experience a lack of trust, respect, or conflict, we start to feel stressed. And when we feel stressed, our brain triggers hormones to support a fight or flight response, and sometimes even a freeze response where you are just unable to do anything. No one wants to feel unsafe. It's unsettling and it creates chaos to your psyche. It makes you expend a lot of cognitive energy, and you then become exhausted, not only physically, but emotionally and mentally. And that is the beginning of when we start to have compassion fatigue and burnout in healthcare workers. So Professor Edmonds highlights four critical areas four critical things that as reasons as to why psychological safety is important, particularly in healthcare. That's learning, risk management, innovation, job satisfaction, and job meaning. I would like to focus on the last one, job satisfaction and job meaning. People who have a high sense of psychological safety at work feel more valued, feel more respected by their colleagues and by their bosses, and they feel better about their jobs. I think many of us can relate and think of a time in our professional careers where we had an opinion, but we didn't feel safe enough or brave enough to voice that opinion. And that is what we are trying to get to. We're trying to make sure that your workspace is a space where you don't feel scared to speak up. Because by not speaking up, by suppressing what we're feeling, what we're thinking, can have so many negative consequences in the long run for our mental health, our physical health, and even our performance at work. So then how do we promote psychological safety? There's a lot of research around the best practices, or what are some of the interventions you can do as an organization. And a lot of it is not something you can implement overnight. And I can recognize that right now, there are managers out there that are dealing with distressed employees and are overwhelmed because they were never really trained in how to deal with that. And so as much as there are 13 enablers of psychological health and safety within the healthcare context, we have to be realistic of what we can currently do right now to contain the emotions our colleagues and our employees are feeling, and also promote a sense of psychological health and well-being. So one of the pieces of advice I can give around what you can do individually and what an organization can do is what I've put down as the 3 R's: recognize, respond, and refer. Recognize by encouraging dialogue and fostering trust. As a manager, you would be able to recognize early on when staff are struggling and intervene appropriately. At the individual level, this brings me back to the picture I put up around the video we developed around thoughts, feelings, and behavior. By recognizing and identifying what you are thinking and feeling can help you to start interacting and intervening early on before you get to the stage where you may need time off from work. And full disclosure, I'm not saying ignore your mental health or fix everything yourself, because definitely the onus is not on the individual to fix everything and just carry on, but neither is it on the organization. There has to be a balance. Respond. Be proactive, prompt, and effective in your response to any threats that are either psychological or threaten the physical safety of your staff. In healthcare, within our current healthcare system in South Africa, I know that prevention is being preached because we have for many years focused more on the curative aspect of healthcare. And now we want to be more proactive. We want to prevent before it requires serious intervention. And then refer, have policies and structures in place where staff can be referred to for more in-depth professional or extensive help should they need it. Don't wait to only put a resource in place or start to think about developing a policy once a situation has arisen. By being reactive, we sometimes miss a lot of the important features or steps we need to do to create a psychologically safe workspace. So where to start? That's always the number one question. Before you can intervene, and this is the research side of my brain speaking, is that I always like to start with having data. I want to understand what is currently happening. What is it that people need? Now, there are 2 really nice assessments I found on the Workplace Strategies for Mental Health website, which were developed by Canada Life. So full disclosure, this was not developed for our context. However, I think it does give us an important starting point for starting to think about and identifying the different things we need to do and put in place in order to promote psychological safety in the workspace. And so I would highly encourage whether you're a manager or an employee to just go to this website, look through some of the resources they have. Leaders can take the psychologically safe leader assessment. Employees can take the employee feedback assessment, and it sort of helps to balance it out because it asks the employee how psychologically safe their workspace is and what are some of the areas or some of the ways in which their leaders promote psychological safety. So I'm very much aware that I was asked to leave you with some tangible tips of what you can do and what you can take away from this webinar. A very nice article was written around understanding and addressing the sources of anxiety among healthcare professionals during COVID-19. And this study was done, and they asked healthcare professionals, what is it that they would need from their organization during COVID-19? What is it that they would want their organization to provide? How would they want to be supported? And 5 major themes emerged. The healthcare professionals said they want to be heard. They said, hear me, protect me, prepare me, support me, care for me. And what I like about this table, and time would not permit me to go into all of this, but it tells you the concerns around hearing me. So what is it, how are healthcare workers find it feeling? How do they think they're not being heard? And then it also tells you how the organization can respond to this. So I found this to be quite nice and practical, and definitely a good resource for organizations wanting to start engaging around some of the things they could do to promote psychological safety. But the biggest takeaway from this was, don't guess what your staff need. Don't guess what you need. Ask. talk to people, when you ask your staff what they need, and you fostered a workspace or a work environment where they feel free to share without being reprimanded, you'll tend to, one, get the answers of what you should be doing and how you can improve. Then another resource I found that was done in, that's applicable for whether you've got 30 seconds, 3 minutes, or 30 minutes, was on COVID Care Gauteng website. The link is on the slide, and I will ask Rory to share that with whoever's interested, or you can email me. And I really like that these suggestions were grouped into things that would take 30 seconds, 3 minutes, or 30 minutes. And so you don't need to do a whole 2-hour meditation activity. This is very much realistic things that you can do quickly to just help if you're feeling a little bit panicky or you're feeling scared or unable to cope. So I would encourage you to visit the site, whether you're a healthcare worker or not. I really find a lot of their tips to be really useful and practical. And then I'd like to leave you with a last thought. All right. As a manager or an employee, one key piece of advice I can give you is embrace the uncertainty. It may seem like a strange piece of advice, but what I found is that a lot of our stressors and negative emotions and feelings stem from trying to control or stop what we are feeling, because we've been conditioned to believe that emotions or caring make us weak. We've been trained to not show people when they've hurt us. And this is ineffective. This makes us ineffective at our job. It'll lead us to suffer from compassion fatigue and burnout, because we are trying to avoid caring and we are trying to avoid empathizing with others. But when we do that, we also disconnecting from ourselves. So as much as we are trying to protect ourselves from being overwhelmed by our emotions, not feeling anything in the long run can lead to burnout. Every sensation in our body is like a wave of energy. And one of the things that we need to learn to do is, how do we ride this wave of energy? Now, UKZN, in collaboration with the KZN DOH, has developed a series of videos to help both members of the community as well as healthcare workers to deal with the emotions related to COVID-19. This is just a start of some of the ways in which you can work through what you are feeling and how managers can promote psychological safety in the workplace. So these are the 4 videos: dealing with fear and anxiety, problem management for healthcare workers, containing management, which is a video which speaks about creating circles of safety within primary healthcare settings, emergency care settings, within the healthcare context. And then lastly, the last video is around dealing with grief and loss. And this was created with an African community in mind, with our healthcare workers that are working in primary healthcare, that are on the front lines. And so I do encourage you to check it out on either the UKZN YouTube page or the CRH, the Center for Rural Health webpage, or the KZN DOH webpage. So that is, I've come to the end, and I really want to thank you for taking the time to listen to this webinar. And thank you once again to African Federation of Emergency Medicine for having me. And if anyone has any questions or comments, I'm happy to engage around that. Thank you. Back to you, Rory.
Thank you so much, Dr. Petrus. That was really informative and covered so much information. So I'm sure that we have a lot of questions. So if people just want to enter their questions into the Q&A section or the chat, we do have one that's already come up from Saul Cobbing. Hopefully I pronounced your name correctly.
Okay, yeah, thanks for setting this up, and well done, Ruwayda. That was great.
Thanks, Saul.
So I actually answered no to that kind of question. Would I raise a mental health issue if I'm struggling with my line manager? And, you know, I'm very pro kind of mental health, but I was thinking if even I would sort of feel awkward doing that, how do I I'm the head of my department, would I kind of approach one of my staff members who I could see is struggling? And thank you, you did give us some kind of tips there to make it a safe environment. But, would it be appropriate if it was very obvious someone was having issues, well, I shouldn't say issues, just struggling, to kind of take them aside on a one-on-one basis?
All right, thanks, Saul. That's a very important question. And I think, we all are struggling with that. Where because there's a line between, if it's a professional setting, how do I just start to talk to someone about this, given that they may not want to share? Personally, my piece of advice is whenever I see someone struggling, I would offer to help, or I would try and find out what assistance they may need. Now, of course, it's never as straightforward as that, but I do think that your suggestion of chatting to them one-on-one is perfectly fine. Not everyone has the communication skills to talk about mental health in a very neutral way where the person doesn't feel obligated to disclose. So it's very much about working on how you working up that rapport with your staff members, where they know that when you do ask them how they're doing, that it's something you really care about the answer, and you're not just asking it to tell them how much work they've been doing. So I often find that with certain managers, if they say, so how are you doing? I'm very quick to say, oh no, I've done this, I've done that. I know I still owe you this, it's coming. And that would mean I don't feel safe enough to disclose when I'm struggling. But at other times, if someone else asks me, I can be very honest to say, well, I'm having a hard time. So I think it depends on the relationship you build with the staff member and the relationship you have. And just letting them know that they are seen and that they are heard can be an important first step to when they do feel ready to disclose, they will come to you. I hope that answers your question.
Yeah, it does. Thank you. That's great. Thanks, Ruwayda.
Thank you, Saul.
Great. Thank you so much, Saul. So I'm just waiting for more questions to come through. In the meantime, I know that Ruwayda provided quite a few resources, and I've made sure that those are available to you all in the chat. So you will be able to see quite a few. I did see a question come through from Thilo. Look again. Yes, I do see that question. So Thilo, I'm just going to, and I hope I'm pronouncing your name correctly. Apologies if I'm not. But I'm just going to find you so that you can pose your question directly. So Thilo, are you there? Can you try?
Yes, I'm here. I just wanted to say it was a really great presentation, Ruwayda, and very, very pertinent. I work in a government hospital, and I was just wondering, we are fortunate to have a team of clinical psychologists and an EAP practitioner and occupational health services. But what are the other facilities, across government departments that are dealing with the bulk of the COVID epidemic to help employees? Because we're actually in the thick of things, and if they didn't have structures in place, what recommendations would you have for them to fast track these systems?
All right, thank you, Thilo. Well, I think that there are certain government structures or facilities that have a great EAP, and as you mentioned, you've got clinical psychologists. I would really encourage places that are low resourced to really start building a relationship with universities like UKZN. I mean, these resources that we developed was done in collaboration with the DOH, and it was done because we realized that there was a gap. I also think that as a person, you don't need to be a manager per se. There are quite a lot of resources online. SADC has got great resources. They've got webinars, they've got trainings. If you want to learn, if you want to know how to do psychological first aid, and so forth. But I do think that this is something we need to talk about a little bit about more. We need to engage with it, and we need to see how we as universities can start to intervene in those low resource settings and start to build up these structures for, that can create a psychologically safe workspace.
No, thank you very much. Just a quick follow-up. You mentioned the Occupational Health and Safety Act in terms of creating a safe working environment. But when we do a risk assessment, do we look at the psychological safety? Are there tools to measure that of employees?
Yes, so this is a nice debate we've been having within our field of industrial psychology. And I speak under correction, but I do know that there were some amendments to the Occupational Health and Safety Act to really be more articulate and clear about what we mean with the responsibility around mental health and well-being in the workplace. There are tools to measure this. It depends what approach you want to take. So a lot of the times you might want to look at the organizational culture and climate, and you sort of want to start to establish and understand what are the characteristics or the capacities or the skills of the leader, what kind of environment is it? And from those types of scales that you use, you can then start to tease out whether there are enough psychological resources, or if there are people who need psychological help but they're not getting it. You can also, there are tools to assess the efficacy or the effectiveness of your EAP programs. I would always encourage EAP divisions to annually review what they've set out to do, whether they've achieved their objective, and get feedback from the people that they are providing the service to.
Excellent. Thank you.
Thanks, Thilo.
Thank you so much. Our next comment or question comes from Karen Abraham. So Karen, I'm just unmuting you now. Your question or your comment.
Hi, good afternoon. Can you hear me?
Yes, we can hear you.
Okay, yeah, my name is Karen Abraham, and I work for Rossing Uranium Limited in Namibia. Just a comment from my side, and firstly, thank you, Ruwayda, very insightful information and also very relevant, especially for us here, in a mine setting or mine environment. How we deal with, for people who have mental health problems or issues, and if they are not comfortable talking to their leaders or their colleagues, we have wellness advisors on site. People that are trained, people that are specialists in their fields. And normally we refer our workers, we refer the employees to these, to this wellness advisor. And then, after that, the wellness advisor would normally engage with the leader and not share all the information because it's confidential, but in terms of how we can as a business support the employee.
All right, thank you, Karen, for that comment. And I think it's really important to have those structures and to have that referral pathway, which I think also touches on Thilo's concerns around what to do when that isn't available. And I think that we need people that can start to engage and want to start creating these referral pathways, because I'm in no way saying that the responsibility of dealing with mental health issues in the workspace is solely on the organization, because we also know people might just need information about where they can access help and resources. And so that's very key for organizations to start sharing.
Yeah. Thank you.
Thank you.
Thank you so
Rory,
much.
I don't know if we've got another question.
Yes, we do. So I'm just going to allow for Eva to speak now. Eva, you should now be able to share your comment or question.
All right. Good afternoon, everybody. My comment or question is on, it's easy when COVID was in China, it was easy to speak about it and relate to it from a far point of view. But Dr. Ruwayda, are there any tools available when COVID is so close or one of your colleagues dies as a result of COVID? Is there anything that has been recommended or available for industries out there to quickly give a counseling or speak to the workers about close COVID-related deaths with colleagues? Thank you.
Thank you, Eva, for that question. So as I mentioned, we have developed 4 videos, which although it's specific, video 2 and 3, which is problem management for healthcare workers and containing management, is specific to the healthcare setting. It is applicable, in my opinion, to other contexts as well. And then with around grief and loss, we have a video so everyone who contributed to this video, they're South African or African. And so we feel that these 4 videos could help start the conversation and also can start to help organizations think about some of the things they want to implement or can implement that's not going to cost them an arm and a leg. And then what's very important is that in dealing with COVID, if there's a colleague that has, passed on because of COVID-19 or someone's become infected, I think it's very key for managers to address this and talk about this and offer a platform where people can share their feelings, because avoiding it or ignoring it is just going to make the problem worse.
Thank you.
Thank you so much. And then our last question, we do have another question from Dr. Joseph. So Dr. Joseph, I'm just going to unmute you now, one moment. And you can feel free to ask your question now, Dr. Joseph.
Okay, thank you, Petra, for the presentation. The question I want to ask is, in mental health issues currently with the COVID pandemic has even escalated more. So I just want to ask quickly, if you notice a concern, okay, maybe a member of staff, how do you relate your concern of mental health issue, okay, maybe to the organization, without confidentiality, or in a case where has denial, okay, but you have observed certain trends or patterns, and it occurs to you that this patient has some mental health concerns, okay. So one, either the patient, in one scenario, the patient has confided in you, okay, and you know that it's a challenge, but is refusing to go for help, to get help because of the stigma, or the other, the patient is even the member of staff is denying that there's such existence of things, but the patterns are clear. So how do you help such persons in the context of the work environment? That's one. And the second question is with respect to creating the environment for psychological safety. Who takes that responsibility? Is it the manager of the organization? And if yes, the organization is not making it available, how do you, as an employee or as a member of staff, okay, help in that kind of setting? Thank you.
Thank you, Dr. Joseph. So if I understand correctly, you've got 2 questions. The first one is around it boils down to how do you help someone who doesn't want to be helped? And the second question is around whose responsibility is it to create psychologically safe workspaces? So in response to your first question, I think that, as I mentioned, human beings are complex. We are very messy. There's multiple layers to us. And so in my personal opinion, if someone has been diagnosed with a mental health condition and doesn't want to have to be helped or go for treatment, there's really like your hands are tied, in the sense that we need the patient's buy-in in order to provide person-centered care. They need to be a collaborator in their treatment plan. And I think that the Mental Health Care Act and even the guidelines that you probably are working with, they're very clear about what is your responsibility as a medical professional when someone is presenting with certain characteristics or traits, and then you've got to follow those guidelines to make the correct decision. But I would also want to, if there's anyone in the group who wants to respond to this, because I'm not a medical doctor, but from my interactions with the healthcare system and the Mental Health Care Act, I don't think you can force someone into treatment unless they are a danger to themselves or they're a danger to others. And I hope that answers your first question, but of course, anyone else can chime in. And then secondly, as I mentioned, the responsibility isn't purely on the organization to create a psychologically safe workspace, but it's also not the responsibility of the employee. Both employers have responsibilities. And when it comes to creating a psychologically safe work environment, I think that a collaborative approach is always best. And so if your workspace is not psychologically safe according to you, the employee, if you are comfortable, you could start to, in a very non-judgmental, non-combative way, start to maybe engage and talk to colleagues and a manager you may be comfortable with around what you can do to get the organization to start investing and promoting psychological safety. I hope that answers your questions, Dr. Joseph.
Yeah, thank you. Thank you.
All right, you're welcome. Rory, sorry, I see that Swasti has asked me to just, in simple terms, explain what we mean with psychological safety. So if I can have maybe 1 more minute, I know we are over time.
Yeah, that's no problem. And then we do have one last question from Dr. Ken Diongo. So I'll just let him ask his question after you go through.
Okay, all right, we'll end with him. So in the simplest way I can explain it, psychological safety is around safety and assurance. And when we say safety and assurance, it's about an environment where you will feel comfortable voicing your concerns or asking for help, whether it is help in treating a patient or whether it is help for yourself in terms of getting access to resources that can help you to cope better. It's a space, psychological safety is something, it's when you feel that you are able to work with others and not be judged and learn and be in an environment that actually fosters your personal and professional growth, and that you are actually learning instead of having to know everything and have all the answers. So I like to think of it as the safety net for anyone who needs it, where if they ask a question, if they make a comment, if they suggest something, it won't be dismissed simply because you're a junior member of staff, but that it will be treated with respect and that people will engage with you around it. So Swasti, does that help to clarify it?
Yes, thank you, Ruwayda.
Okay, perfect. So Rory, we can go ahead with the last question.
Yes, perfect. So Ken, you should now be able to ask your question.
Yeah, thank you very much, Rory. I hope you can hear me. That was a great presentation, Dr. Petrus. I really learned a lot. Actually, psychological health and safety at the workplace, especially for us in emergency care, it's quite interesting because throughout trainings and years of practice, clinicians have been made sort of to believe that and act as tough guy with thick skin, and not appeal, which is a big issue because we see death, diversity, the worst side of humanity in our practice, and often we try to block this out. And actually, COVID, as you say, has just made this worse. So I think showing vulnerability should definitely be normalized, and from the training already, and in residency and so forth. So I was wondering, in your experience, in academia and in your setting, do you have any experience in introducing this concept of psychological safety in undergraduate training, for example, medical curriculum, so that it starts quite early for people to understand that showing vulnerability is actually a strength and not a weakness, and that positively affects our clinical practice. So that was what I wanted to hear from your side. Thanks.
Thanks, Ken. You are speaking something that's so close to my heart, and I've heard this a lot from the healthcare workers that I've worked with, where they say, the general public and even our managers don't see us as human. They think that we get an injection that shuts down our emotions. So I like what you say about we need to start normalizing vulnerability. It's not a weakness, it is a strength. And in terms of undergraduate training, I am aware that our medical school at UKZN started to introduce, I don't know about psychological health and safety, but definitely they've started to introduce clinical communication skills. And the way I have trained clinical communication skills for person-centered care within primary healthcare clinics is that it's a way that it's a way for us to find out what matters to the patient and what is the matter with the patient. But at the same time, we can turn those skills onto ourselves to recognize when we are struggling, when we are having to deal with difficult emotions, and then make sure that we get either outside help or we have positive ways to process those informations and thoughts and deal with them. So I don't think that, I think there's still a lot more work that needs to be done in getting these psychological health and safety concepts and constructs and how to implement it and practice it into the undergraduate curriculum across the different health disciplines. But I think in some aspect it is there, but there's still more that can be done. So that is definitely an area that I'm interested in exploring in not only for the healthcare setting, but I mean in terms of the students we train in our psychology discipline as well. I hope that answers your question and your comment.
Thank you so much. I think that was a really comprehensive response, and I do see a couple of thank yous coming through just for your presentation generally, Dr. Ruwayda. So that is all that we have time for, and I'm so happy that we were able to have such an involved question and answer session at the end as well, because I know that so much information was covered by Dr. Petrus. And to note, we will be posting both the recording and Dr. Ruwayda's PowerPoint on AFEM's website. So before that gets posted, we did put the links in the chat. So if you scroll up through the chat, you should be able to access all of the different links that Dr. Petrus highlighted in her presentation. And you can sort of pull those now, but we should be able to upload them to the website soon through her PowerPoint presentation. But I just wanted to say a huge thank you to all of our attendees who engaged and asked questions and attended today's presentation. And a huge thank you to Dr. Petrus for providing us with such a comprehensive and holistic look at psychological health and well-being and safety in the workplace and how to sort of tackle that in such an unprecedented pandemic. So thank you so much. And yeah, great.
Thank you, Rory. Thank you, AFEM, and thank you to each and every person who attended and for all of the engagement. I really enjoyed it.